Well, it's a potentially huge medical breakthrough in Alzheimer's research, a new blood test that could predict if people will get the debilitating brain disease that affects millions of us. CNN senior medical correspondent Elizabeth Cohen has more.
There hasn't been a good way to predict who will get Alzheimer's disease, whose brains will get the plaques and tangles that destroy memory and concentration, and who will be spared. But in a first-of-its-kind study, a simple blood test was able to predict who would get Alzheimer's.
This is a really wonderful piece of science. It's the most significant observation that we've been able to report in my entire scientific career.
The researchers looked at the blood of healthy elderly people, checking for 10 fatty molecules called lipids. Those who had lower levels of lipids were more likely to develop Alzheimer's or the memory problems that precede Alzheimer's. On average, the change from healthy to sick took just 2 years, and the test was over 90% accurate. The researchers and the Alzheimer's Association point out that more studies need to be done to check and see if this test really works. And even if all goes well, the test won't be in doctors' offices for several years. So, who would want a test to predict Alzheimer's? After all, there's nothing you can do to stop it. Dr. Howard Fedoroff, a researcher in the study, says he'd want to know.
I would want to plan. I would want to work with my family to make sure that I attend to the issues that are important to us.
But some people might not want to know that they're destined for a devastating disease.
Senior medical correspondent Elizabeth Cohen joining us now. So, Elizabeth, how does this get us any closer to any sort of treatment for Alzheimer's?
Kyra, here's the way that it works. Doctors want to prevent Alzheimer's. They don't want to just treat it. They really want to prevent it. And if you can put together a group of, say, 100 people who you're pretty sure are destined to get Alzheimer's, then you can try out treatments on them and see what works. Right now, we can't do that. So if this test can give us a nice group of people to study, it would really advance this research by a long shot.
All right, we'll keep following it for sure. Elizabeth Cohen, thank you so
Thanks.
much. All right, you just heard Elizabeth's report. So what do you think now? Would you want to know if Alzheimer's was in your future or not? Psychologist Erik Fisher here to talk about those emotional, ethical, psychological issues, right? I don't know. I mean, I would want to be proactive. I would want to change my odds. What are your thoughts?
Well, I think we have to look at each individual psychology and how they handle stress. How do they handle knowing things? Some people, for them, ignorance is bliss. So they don't want to know what's coming. They don't want to know their future in some ways because that can bring on stress. So I think, though, you're right. Planning is a good thing. You can plan where you want to live. If you know that you have this diagnosis, what do you want to change about your life? What do you want to simplify?
How about the drugs, though, that delay the onset? There's been so many, developments that have been made on that scale.
Absolutely. And being able to take those to forestall the onset or slow the onset of Alzheimer's would be good. The other issue you have to look at is they looked at 70-year-olds in this study. They're going to start to look at middle-aged people, potentially in their 60s, 50s, who knows how old they'll start to be able to identify this. So as we get to younger and younger years or ages of identifying Alzheimer's or even other debilitating types of illnesses, what is going to be the impact on long-term planning of those individuals?
But this isn't 100%, right?
Right.
Nothing ever is.
Exactly.
So we've got the issue of false positives.
Exactly.
Let's talk about the impact of that.
That can be devastating because if I've made all these plans that I'm going to develop Alzheimer's and I never develop it and I've changed it, people in my life have changed the way they've treated me because of that. Maybe a relationship ended. Maybe I've resigned from a job or made some different investment choices. That can have huge impacts on somebody's present and future of their life.
I was reading, this was interesting, and I wanted to get the quote right. This is a medical ethicist at the University of Pennsylvania who said that people who have the Alzheimer's gene and know it tend to rate their own memories as worse than people who have the gene but don't know it. Knowing you carry the gene also seems to hurt people's performance on many memory tests.
Exactly. That's a self-fulfilling prophecy. And just by the fact of knowing that you may have something, that self-fulfilling prophecy often comes true. So that's where some people would also rather not know because they want to live their best life that they can. For me, like I said, I'd rather know and make every day the best day it can be.
Amen, brother. I'm with you on that. Erik Fisher, thank you so much.
Thank you.
Well, coming up.